infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to Outbreak News Interviews. Now, last month, the CDC released some numbers on parasitic infections caused by Cryptosporidium, or crypto, in the United States. And we see some real increases in outbreaks over the past decade or so. Well, joining me today to look at the Cryptosporidium situation in the United States is Joseph Eisenberg, Ph.D., M.P.H. Dr. Eisenberg is the chair of epidemiology at the University of Michigan's School of Public Health. Dr. Eisenberg, welcome to the show, sir.
Thank you.
Okay, well, let's go ahead and start out with explaining to the audience, what is Cryptosporidium, and can you give a brief history of crypto as a pathogen in the U.S.?
Yeah, so Cryptosporidium is a protozoan parasite that I think back in 1996 was the first documented case in which we found Cryptosporidium causing disease in humans. Prior to that, it was known to be a pathogen of livestock, and it continues to be a pathogen of livestock, and therefore it's a zoonotic pathogen in that people can get infected from infectious livestock, cattle, chickens, pigs. But also, Cryptosporidium can be transmitted from human to human. So it actually has potential both to be zoonotic, but also person to person. It became an important pathogen in the U.S. because it is resistant to chlorine, which is the first line, a major defense line for water treatment facilities. And it's a small protozoan. Most of the filtering in drinking water plants was designed to filter out Giardia, which is a larger protozoan parasite. And so Cryptosporidium was able to move through the filters of drinking water plants as well as evade the chlorine for treatment. And that's also true with swimming pools. Swimming pools, chlorine is the way in which we ensure that the pool is safe. And Cryptosporidium, again, resistant to chlorine, is one of the reasons why it's increased predominantly in swimming pool-related outbreaks.
So what is the pathology associated with crypto? What are the typical signs and symptoms?
It causes diarrhea, and it causes a characteristic, what we call watery diarrhea. It's not a pleasant disease to have, but it is self-limiting for people that are immunocompetent. If you're immunocompromised, it can be a dangerous pathogen causing persistent diarrhea and often leading to mortality. It is an AIDS-defining illness. That means that if you're HIV positive and you have cryptosporidiosis, that defines you as having AIDS, and it's lethal for anybody that's HIV positive with low CD4 counts. It's also for anybody that's immunocompromised due to chemotherapy, for instance, would also be at risk of getting a severe case of cryptosporidiosis.
Yeah, now the CDC recently published a MMWR report, and it detailed some numbers on the outbreaks in the United States. Dr. Eisenberg, what did the report state?
Yeah, it basically said that over the past 10 years, the number of outbreaks associated with Cryptosporidium has increased 13% every year. And most of those outbreaks were associated with swimming pools and treated swimming pools. Some of the outbreaks were due to other kind of swimming impoundments like recreational lakes. others associated with petting zoos, for instance, which, because again it's a zoonotic pathogen, we are susceptible to getting the infection from animals. So the alarming numbers really was that how much Cryptosporidium has increased in circulation throughout these last 10 years.
What would you attribute that to?
Well, I think a number of things. One is we can see that the incidence of cryptosporidiosis is increasing, and so thereby that means there's more pathogens circulating in the country. And again, for a swimming pool where chlorine is the main mode of treating and making sure your swimming pool is safe, Cryptosporidium can evade that treatment. It also, with respect to things like drinking water plants, it's really expensive to upgrade, lots of capital cost to upgrade a drinking water treatment plant. And so to the degree in which all treatment plants have upgraded is a question. I mean, most of the bigger ones have, but a lot of the smaller ones have not. And so you still have plants that are relying on chlorine, for instance, for disinfection, and potentially the filtration is not quite at what it would need to be. So I think that we are slowly catching up to the infrastructure development to control crypto, but not necessarily enough to keep it at bay right now.
Yeah, and you mentioned that crypto was essentially self-limiting in those that are immunocompetent. But if somebody requires treatment, is it a treatable parasitic infection?
There is anti-parasitic medication for it. It's also, I'm not a physician, but I would say that keeping hydrated is probably the most important thing for a symptom that's watery diarrhea. But then also, in addition to that, there are anti-parasitic drugs. I think the concern would be that somebody confuses it with a bacteria, might be taking antibiotics, and that would not treat the disease at all.
Now, what can the public do, in particular parents, to prevent infection with Cryptosporidium?
To prevent infection, you just want to preventing infection actually is much different and more difficult than it is to prevent spread. And most of the CDC recommendations are about preventing spread. That is, if your child is sick, don't let them swim in a public swimming pool. Hand hygiene is going to be important. A child wearing diapers shouldn't be swimming in a swimming pool. I think if you want to prevent exposure, you might want to pay more attention to how your public swimming pool is being managed, so that they are quick to identifying any kind of contamination in the pool and close down the pool before cases are generated. I guess with respect to a petting zoo, maybe their hand hygiene would be important. That if you're visiting a petting zoo, you'd want to wash your hands right after that visit. So it is a fecal oral disease it's your standard kinds of hand hygiene and decontamination are similar across any kind of enteric pathogen.
Okay, so we know about the situation of crypto in the United States. How big of a problem is it outside the United States?
It's actually a huge problem outside the United States. There was a recently published large study called the GEM study, published maybe 5 or so years ago, and it was looking at the etiology of diarrheal disease in moderate to severe cases of diarrheal disease. And probably the biggest surprise from that study was how important Cryptosporidium was as an etiology. And normally we think of diseases like rotavirus, we think of Shigella and some of E. coli pathogens as being the principal causes and leading causes of disease burden for instance, infant mortality. But now we're realizing from that study that Cryptosporidium is as important or more important than those diseases, those pathogens. So I think it is now, in the past 5 years, on people's radar as a leading cause of, for instance, infant mortality in the world.
Okay. Any final thoughts on crypto, the MMWR report, or anything else related to this?
Just that, I think that this MMWR report, probably less surprising to me than the GEMS report that I talked to you about, the global burden, that I think it's been on the radar of the EPA, who regulates water. It's been on the radar of CDC, who looks at controlling outbreaks, but not so much in the public view. And I think that this report hopefully will, and podcasts like these will hopefully bring people aware, make people aware of the fact that this is an important pathogen, and it again has evolved to evade the kinds of ways in which we try and treat our water, and we need to be thinking about, improving our infrastructure in the future, which takes support, takes money to do. But I think that this, at this point, it should be one of the top priorities in thinking about how to improve our water, recreational and drinking water infrastructure.
Well, very good. I want to thank you, Dr. Joseph Eisenberg, for sharing your time and your expertise. Thank you, sir.
Thank you.